Good evening, everyone. Myself, Dr. Vinod Kaushik, on the behalf of IIP India Digital Team, just welcomes you all to the today webinar. The topic of the webinar is Oral Health in the Pregnant Woman by Dr. Neha Kapila, ma'am. It's organized by IIP Women's Cell and IIP Punjab branch. And the today moderator of the webinar is ma'am Dr. Priyanka Rishi. Ma'am is State Sub-Coordinator Punjab State IIP Women's Cell. Ma'am is Associate Professor and Head of the Laboratories, Department of Physiotherapy, Lovely Professional University. And I just shows my gratitude towards Dr. Sanjeev K. Jha, IIP President, and Dr. Ruchi Vashnai, IIP Women's Cell National Head, for providing us this wonderful platform for sharing the knowledge. And I just request everyone, please subscribe IIP India YouTube channel and other social platform of the IAP India. Now I will just hand over to Dr. Priyanka Rishi. Please continue with this webinar. Okay, Dr. Priyanka Rishi, please continue.
Thank you, sir. Sorry about this small technical glitch. I wasn't actually able to unmute myself. Good evening, everyone, and welcome to today's webinar hosted by IAPWC Punjab team and IAP Punjab chapter, Oral Health Care in Pregnant Women. Before I go further, I want to actually review certain points about the webinar. Your active participation is important throughout the session. And right now, I think everybody is on mute so that you don't get disturbed during the webinar and you are able to hear properly. You can enter your questions and comment in the chat box throughout the session. We are fortunate to have IAP and IAPWC in support of us, providing us this platform for organizing this session, and extending my special gratitude to Dr. Sanjeev K. Jha sir and Dr. Ruchi Vashne ma'am for their never-ending support. At this stage, I would like to introduce our eminent guest speaker for this event, Dr. Neha Kapila, a general dentist currently practicing in Chicago, USA, a coach and founder of Dentist Coach. She is fabulously handling all the aspects of dentistry from clinical to coaching dental professionals, both pre-dental, international dentist to practicing dentists, in various life leadership and pre-dental aspects. A dedicated dental clinician and a well-rounded professional, she is fully committed to her patients. With over 20 years of experience, she is affecting the change in her field, and I think this is what matters the most. With pleasure and humility, I present Dr. Neha on board. Over to you, ma'am.
Hello, hi everyone. Thank you, IAP Women's Cell, IAP Punjab State, all the attendees for having me here. I am truly honored, and thank you so much for y'all for giving me some of your time for this presentation. In today's presentation, we will discuss about oral health care for pregnant women and various aspects attached to it. As health professionals, we all know pregnancy is a physiological change which not only affects the women concerned, but also people around her, especially the baby that is going to be coming. So throughout this presentation, we will discuss how pregnancy and dentistry are related, and what can we do as healthcare professionals to take care of our mothers and babies in our offices. Also, where and how different healthcare fields can work in collaboration with each other towards taking care of our pregnant patients holistically. So as healthcare professionals, if we are aware of these things, we can give appropriate guidance to the patients if they have any questions related to dentistry and pregnancy. So let's get started. We can keep going, Dr. Rishi. Mouth is the window to our overall health, and oral health is an important component of general health for everyone. It is seen that if oral health is doing good in a person, generally they are doing good in their um, uh, other overall health wise too. But for women it is very important, especially more important, because when they get pregnant, now not only they are taking care of themselves, but they are taking care of two people, that is themselves and the baby. So oral care must be considered as an important part of prenatal care. Otherwise, mom's poor oral health during pregnancy sometimes can lead to poor health outcomes for both the mom and the baby. So some studies even have shown a link between gum disease and premature birth and low birth weight for the babies. And these babies may have more health problems at birth and then also as they are growing later in life. So, and in fact, one of the studies, it has suggested that approximately 18%, which is a huge number, I believe, of premature low birth weight infants are born prematurely because of the periodontal disease or gum disease in their mothers. In turn, if they are born prematurely, they have low birth weight, it is associated with higher infant mortality risk and increased risk to the infant having certain long-term health problems. So now let's see, how does the pregnancy affect dental health of women? Let's keep going, Dr. Rishi.
Ma'am, just a second. There is some issue. The slide is not moving forward. Just a second.
So I'm going to be discussing now, how does pregnancy as a physiological condition affect dental health of women, or what are the changes that can happen around it. So let's keep going there. During pregnancy, women go through a lot of hormonal changes. We know it, that pregnancy comes with a lot of ups and downs. Physiological changes are happening, which is going to lead to physical and sometimes emotional changes in mom to be also. So what happens with these hormonal variations? Oral health is getting affected too, and usually not for better. The increased levels of certain hormones like progesterone and estrogen in women increases the risk of certain oral health problems. And the surge of these hormones, it can dilate or it can expand the tiny blood vessels that are there in our gums. And when the blood vessels are dilated, it of course increases the blood flow. So when the blood flow in the gums increases, the gums become more sensitive to the bacteria and the toxins that are found in dental plaque that accumulates on the teeth every day. Plaque starts forming on our teeth within minutes as soon as we start eating anything. And we all know, where there is plaque, there are there can be cavities, there can be gum problems, and other oral healthcare problems. The other thing that happens during pregnancy is morning sickness. Now it's called morning sickness, but in women, sometimes, like some women, they're going to experience the nausea, the vomiting, morning sickness throughout the day. Usually happens during first trimester, but for some women it can carry on throughout the pregnancy. If they're feeling sick, if they're throwing up, it can lead to nutrient depletion, dehydration, and that can lead to dryness in the mouth. And with dryness in the mouth, what it means is that the saliva is not going to be in plentiful amount. And if there is less salivary flow and thick ropey saliva, again, it is a very nice breeding ground for bacteria in our mouth, leading to oral health problems. The tongue, it harbors the most amount of bacteria on tongue. Sometimes these patients are gonna start feeling like, I have this coating on my tongue, it's called sores. So that can happen in relation to morning sickness also. Now, of course, food cravings are there. Some pregnant women like to eat sweets, some of them, and sometimes during the early part of pregnancy, they're like, I cannot eat certain foods, or I can eat certain foods. Old wives' tales attached to it that, oh, if you're going to be eating sweets, this woman is going to have a boy, or this woman is going to have a girl, kind of a thing. But the kinds of foods that we eat and frequent snacking goes hand in hand with it, that as frequently as we eat, again the plaque keeps on forming, that acid keeps on forming in our mouth, and that can lead to cavities. Certain changes in oral hygiene habits can occur during pregnancy too, especially the first couple trimesters, when they are having morning sickness going on. Again, a lot of nausea, a lot of gagging. They cannot use the toothbrushes the same. Some women, because of brushing and flossing, can also gag, and then they start slacking on their oral hygiene routine. Everybody gets tired at the end of the day, but add in pregnancy, and that can lead to more exhaustion in pregnant females, and that can lead to them starting to neglect their oral health again. So during this time, or the new moms, they can be like so focused on making everything right and good for their kids, for everything around them, for the little one, that they start neglecting their own health. So now let's see what are some of the common dental problems that can be related to pregnancy. So the first and foremost, cavities. This is the most common and most well-known oral health disease. 1 in 4 women of childbearing age has untreated cavities or tooth decay or dental caries, all of them mean the same. Being pregnant makes women more likely to have cavities and tooth pain in relation to it, if the cavities get bigger in size, and then if they touch the nerve. um, we already discussed some of the causes that can lead to that. Eating more often during pregnancy is common, and then frequent snacking, like I said, puts our teeth in constant contact with acid in the food. When there is so much acid in the mouth, it attracts and increases the production of acid-loving bacteria, such as Streptococcus mutans. It's the most common cavity-causing bacteria, and in our mouths, and that in turn produces more acid. And with that acid forming in the mouth, the tooth enamel, that is the outer covering of the tooth, it starts disintegrating, it starts weakening. And the pH at which all of this demineralization occurs is 5.5, usually at 5.5 and lower pH. The enamel, it keeps on demineralizing, it keeps on disintegrating, and putting teeth at more risk for cavities. For a healthy mouth, the pH should be in neutral range. To keep our teeth healthy, we must keep our oral acidity to minimum. Actually, teeth can become more stronger and even remineralize when mouth has a pH of 7.5 or above. And some of the ways to go ahead and achieve that, to make the teeth stronger and help remineralize some of that enamel, is to use fluoridated toothpaste, to use fluoridated mouthwashes. Fluoride is a wonderful mineral that strengthens the teeth. Fluoridated community water fluoridation is done in most of the world now, to help with all these things and to keep cavities at bay as much as possible. So optimal maternal oral hygiene during prenatal period may decrease the amount of this caries producing oral bacteria, and less chances of it being transmitted to the infant then. All right. So in pregnancy gingivitis. So gingivitis means inflammation of gums. Nearly 60 to 75% of pregnant women have gingivitis or an early stage of periodontal disease. This is an early stage before the supporting tissue of the teeth start getting inflamed and start getting infected. Why does it happen? The increased level of, again, certain hormones like progesterone in pregnancy makes it easier for certain gingivitis causing bacteria to grow, as well as it makes the gum tissue more sensitive to the plaque, and it exaggerates the body's response to toxins that result from the plaque. So in fact, our pregnant patients who already have gingivitis before they get pregnant, all these the symptoms of gingivitis, like the gums are bleeding, as you can see in this picture, they are a little bit red and hot, and they start getting sensitive. Pregnancy makes all these symptoms worsened, because gingivitis was already going on, and now because of the hormonal changes, the all these things are exacerbated. The other thing in relation to this that I wanted to show you all, it's called pregnancy tumor. um, this is basically these tumors are not cancerous. They are called pregnancy tumors because these are localized overgrowth of gums in certain areas in the mouth, usually again because of hormonal changes. And uh, I wanted to emphasize on this fact that pregnancy tumor and pregnancy gingivitis, usually if it is because of pregnancy and hormonal changes, as the woman delivers the child, as the hormones balance out again, they heal on their own. Usually we don't have to do any treatments. Otherwise, if these tumors, if they get very bigger in size, or if it's if the our pregnant patient, if she is having difficulty eating or chewing, or sometimes like they get bigger in size, or if they are in certain locations that when they are swallowing or speaking, if it starts bleeding causing pain, then they might need to be excised. But other than that, usually they heal on their own. Yeah, so let's keep going. Otherwise, like I said, the inflammation of gums, if it's not properly taken care of, if untreated, the gingivitis can lead to periodontal disease called periodontitis, which is inflammation of the supporting tissue of the teeth, like ligaments and bone. This is a serious gum infection. It can damage gums and it can destroy the jawbone. And once we lose bone, we cannot get it back unless we do bone graftings and certain procedures like that. Periodontitis is otherwise fairly common, but also very preventable, usually caused by poor oral hygiene. But if we do not again treat it, it can even lead to tooth loss. Right. Some of the symptoms that the patients come up with is that my teeth are loose or they are hurting, the gums are swollen, they are red, they are tender, they bleed. So we have to, and it doesn't heal on its own. Like I said, mostly it's caused by poor oral hygiene. And sometimes what happens is the plaque, it keeps on collecting on the teeth and the gums. And this is what I tell my patients: if it the longer it stays on our teeth and our gums, the salts from our saliva, it is going to start accumulating in the plaque, and then it starts forming tartar. Now tartar, it is, I call it concrete house of bacteria. It starts taking the bone away at that time, and then slowly over time, the bone, it starts disintegrating. And it can lead to other health problems too, like in pregnant patients, all this bacteria, and in general public too, all this bacteria, it can again seep through the gums, in the in through the tiny blood vessels, and it can go in the blood. And from there, in pregnant patients, it can cause preeclampsia, that is the high blood pressure in pregnant females, or gestational diabetes and periodontal disease, it goes hand in hand. um, for our babies, what are the repercussions? They can be all these pro-inflammatory mediators, and all this bacteria, once it gets in the bloodstream, it can get transported through placenta and fetal membranes and amniotic cavity, and it can induce pathological processes, like, and the baby is going to be born preterm or low birth weight. And then we already discussed that how it can sometimes even lead to mortality rate being high because of the periodontal disease in our babies. So proper treatment is needed, and in a timely manner is needed. And usually once the tartar builds up underneath the gums, it needs to be professionally taken care of. The patient needs to be seen by a dentist, and we do deep cleanings for these patients. Sometimes disinfecting the pockets with laser is done on localized areas. Sometimes we use antibiotics just to control all these inflammation and infection going on. And severe disease sometimes even may require surgery. All right. And all right, let's keep going there. Let's see. So, like we discussed, that high levels of hormones, progesterone, and the periodontitis, if it's not taken care of at proper time, it can lead to loosened teeth and tooth loss. But sometimes, in general, if a patient doesn't have even doesn't have periodontitis, sometimes they're going to be like, my teeth feel loose. Why does it happen? Because the body is preparing for delivery. The other ligaments and tendons and the muscles, they are loosening up. The body is preparing for delivery. So the same thing happens in oral cavity. The ligaments that join the teeth with the bone, they start loosening up. And sometimes the patients are like, oh, I don't feel my teeth are strong, or they're holding strong in my bone. But it gets better once the baby is delivered. All right. So other things that can happen is morning sickness. It can do a number in our mouths. This, as the woman is throwing up, the stomach acid, it can come in the mouth. And you can see in the picture too that once the stomach acid comes in the mouth along with the low pH, it starts weakening the tooth enamel. It puts the moms at greater risk of having cavities. Now, with erosion, the other thing that happens is, as we lose that first layer of the tooth, the enamel, the second layer of the tooth, that's called dentin, it gets exposed. Now, dentin is more softer than enamel, and it does have nerve endings in it. Same thing happens with if somebody has periodontal problems going on. The root of the tooth is exposed. The first layer of the root is cementum. The second layer is again dentin. Both of them are softer than the enamel of the tooth. So the dentin and cementum being exposed, the nerve endings are exposed. Patients are gonna have more symptoms of sensitivity. I feel cold when I drink something cold, or they are going to be more prone to decay because, like I said, the dentin is more softer and bacteria can attack it easier than enamel. All right, so how can we prevent all these dental problems during pregnancy for our moms and our babies? first things first, we tell our patients when while we are taking medical history, we ask them, are you pregnant, or is there any chance you can be pregnant or nursing? So we want our pregnant patients to inform us, and also the gynecologist if they are planning on being pregnant, and then also about other health problems that they could be having early on, any prescription medications they are taking or non-prescription medications that they are taking, right? um, Other than that, pregnant women need to watch their diet. They need to have to be taking a very well balanced diet for themselves. Excuse me, I need some water. Excuse me. The pregnant patients, they need to take their prenatal vitamins, and have proper nutrition for themselves and the babies, right? Folic acid is needed to support their baby's health during pregnancy. Baby's teeth usually start developing between 2 to 6 months while the mom is pregnant, while in uterus. And on average, the primary teeth, the baby teeth, they take 10 months for completion of calcification. Calcification means when they start hardening up. The baby teeth begin to form in utero at about 6 weeks of age, and the permanent teeth, they begin to develop at approximately 4 months of age in utero. So the nutrients like calcium, phosphorus, protein, we tell vitamins A, C, D, they help the teeth, the baby's teeth, grow healthy in mom's uterus. So I wanted to emphasize this fact that when moms are choosing for all these prenatal vitamins, steer clear of the chewy or gummy vitamins, especially if they're taking them after brushing teeth or before bed, because most of these gummy vitamins, they are sticky and most of them have sugars in it, and sugars can damage teeth. um, the other thing is that, of course, maintain good oral hygiene regimen during pregnancy. Brushing every time they eat, if not at least 2 times every day, is a must. And flossing and taking care of that plaque from in between the teeth is needed, because at least 30% of the plaque sits in between the teeth, and it doesn't go away if we don't floss and mechanically remove that plaque from in between our teeth. And flossing needs to be done at least once in 24 hours. Use fluoridated mouthwashes, and usually I tell my patients to brush and floss and then mouthwash with the fluoridated non-alcoholic mouthwash, because again, alcohol can dry the mouth, and it's very counterintuitive. We discussed how dry mouth can lead to more cavities. So do that, and then don't eat or drink anything for about half an hour at least. Let that fluoride, the topical fluoride, sit on the teeth. Other than that, cleaning the tongue is very important. Tongue harbors the most amount of bacteria, so tongue cleaners are there, or brush the tongue. But sometimes brushing the tongue can lead to a lot more gagging and nausea. So using tongue cleaners can be helpful for those patients. Regular dental checkups, along with all these things before and during pregnancy, is a must. All right. So, other than that, I wanted to emphasize that during pregnancy, certain things to avoid for pregnant moms or pregnant women are like tobacco, alcohol, marijuana, any illegal drugs. They should not be taken, and prescription medications, even prescription medications for non-medical reasons, should not be taken. Avoiding these substances and getting regular prenatal care is very important for healthy pregnancy for both our moms and the babies. Otherwise, for example, babies born to women who smoked during pregnancy, let's say, are at a very high risk of a lot of health problems. They can have low birth weight, they can have birth defects in oral cavity, they can have cleft lip and cleft palate. It's like the split on the lip and the palate. These kids sometimes have higher rate of colic, that is like they're going to be uncontrollably crying and irritable, and they keep throwing up, they cannot digest their food properly. um, it can lead to sudden infant death syndrome, it can lead to babies born still. The children, they can sometimes have asthma or obesity, other health problems that can last a lifetime. They some kids, they can have cerebral palsy, or have learning disabilities, neurological deficits, behavioral health problems that can appear either early in childhood, or sometimes we see that even some of the patients, they show symptoms of all of these difficulties and diseases in adulthood. Now I wanted to again put your all's attention to this, that these children and these adults, as we see it in our offices, they have a very hard time keeping their teeth clean by themselves, even if we tell them to use rotary toothbrushes and whatever, because manual dexterity is not that good, or for that matter, even for their caregivers, it's very hard to take care of their teeth. So prevention of any oral health care problems is kind of mandatory and very important in these patients. So again, being a physiotherapist, you all must see a lot of patients with physical and learning disabilities, and this is where possibly the dental professionals and physiotherapist paths can collide. And physiotherapists can refer patients to dentists where they see that, oh, these patients might be having oral health care problems or speech problems, or and early intervention can tremendously help these patients. One of the medications, like I said, a lot of the medications need to be avoided, but one of the medications I wanted to give an example for you all to avoid during pregnancy is tetracycline. It's an antibiotic, and if the teeth are exposed to tetracycline, whether in or out of utero, at the time when the teeth are calcifying or mineralizing, the tetracycline, it binds to the calcium of the teeth, and it can happen even prior to eruption of the teeth, as we saw that they start calcifying as soon as they erupt or in utero. So, and tetracycline can cause yellow to gray to brown discoloration of the teeth, and usually it's very hard to get rid of these stains, as you can see in the picture over here. These days with zoom whitenings and stuff, some of the teeth we can get rid of tetracycline stains, but more often than not, it's very difficult, and then more aggressive treatments need to be done on teeth, like putting veneers on or doing crowns and stuff. So avoiding certain medications is going to be helpful, not just for the mom but also for the baby. All right, so how does mom's dental health during pregnancy affects babies oral health? Early childhood caries is the tooth decay in children under 6 years of age, and it is one of the most prevalent chronic disease in children. A mother can pass bacteria that causes cavities to baby during pregnancy and even after birth. The bacteria from mother's mouth can be transmitted, like we discussed, that those tiny blood vessels, the bacteria can seep through them and get in the bloodstream and in the amniotic fluid and get to the unborn child, and this can contribute the risk of a premature delivery or low birth weight baby. It can lead to premature contractions or infection of the newborn child. Sometimes in the mouth we see that the prematurely born babies, they can have enamel hypoplasia, which is like the enamel is very soft, the tissues are not formed properly, in the mouth. Other developmental defects are seen in the teeth and the jaws, the skull, cleft lip and palate. There are speech problems, other developmental problems. So the presence of untreated cavities in mother's mouth can increase her newborn's risk of getting tooth decay as a baby is uh, growing, or even when they are born. Tooth decay, I want to emphasize, it's a multifactorial disease, it's infectious, it is transmissible disease, right? In part, it can happen from buildup of the cavity causing bacteria in the mouth. Now, these bacteria, they can spread from person to person, including, like we said, from mother to newborn child through saliva. So one of the best known types of cavity producing bacteria in our mouths is streptococcus mutans or mutans streptococci. And it's been seen that the higher the level of MS or mutant streptococci in a person's mouth, the higher their risk of getting cavities. So for example, if the MS can begin building up in infant's mouth right from the birth, even before the baby has any teeth coming out of the gums. So how does it happen? The higher the level of MS in mother's mouth, the greater the likelihood that she's gonna spread that bacteria to her infant, and the MS is gonna start building up in infant's mouth. um, and these infants are more prone to and more likely to suffer from tooth decay once their teeth are coming out of the gums. So optimal maternal oral hygiene during this prenatal period may decrease that bacterial load, or that amount of the of MS in their mouths, or that can be transmitted through the um, through certain behaviors to the infant. And most common ones are like we are eating together or sharing spoons or kissing. And I did wanted to just say that not just the moms, like other caregivers, we keep saying moms because primarily moms take care of their babies when they're born, and infants and kids, but other caregivers can do the same, like if they're sharing spoons or kissing, they and if they have a major bacterial load in their mouths, it can be transmitted to their children. So now, how can we prevent all of this? So I as soon as the child's first tooth emerges, I'm still discussing the early childhood caries, or like the rampant decay that can happen because of nursing and baby bottle syndrome. As soon as your child's first tooth emerges, your child can start getting cavities. Sometimes we see little kids coming to the office, and before the tooth erupts, like even if it hasn't come up all the ways, and it also already has cavities. So for this reason, the American Academy of Pediatric Dentistry and American Dental Association recommend that baby's first dental checkup should be scheduled either as soon as the first tooth emerges in their mouth, or at baby's first birthday, whatever comes first. Because research suggests that for each year past a child's first birthday that their parents delay booking their first dental visit, the child's odds of having tooth decay more than doubles. um, and and to prevent the rampant decay, as you can see in these pictures over here, caused by nursing, like some of the kids, if they keep on drinking bottle throughout the night, or if they are breastfeeding more often at night, and their teeth have already erupted, or they are drinking juice throughout the day, these kids, it is recommended that we start weaning off nursing and bottles when child starts eating solid foods and as soon as the first teeth erupts, and then also starting to take care of their oral hygiene as soon as the first tooth erupts is helpful. Just take a wet cloth, clean the teeth. When there are just a couple of teeth, there are finger toothbrushes that come. Usually I tell moms to put one on the child's finger and one in your finger, just so that they start getting used to the whole idea about taking care of their teeth and oral hygiene, right? So keeping keep their teeth clean after eating is very, very important. All right, so how does pregnancy, now let's discuss how does pregnancy affect dental treatment. um, so dentists work in collaboration with OBGYN. We want to know if there are any pre-existing conditions, what if the pregnancy is okay. Sometimes certain pregnancies are higher risk. We might request for a medical clearance from OBGYN as to are there any certain considerations or contraindications for that patient that we need to take. For example, can we use epinephrine in our local anesthesia or not, because certain times it can raise the blood pressure and can lead to contractions. So sometimes we need to avoid that. Or like if the patient is already having certain medical problems like diabetes or high blood pressure, and they are being watched very, or the if the pregnancy is high risk and they are being watched very closely by their OBGYN, we want to know that, and sometimes we request for medical clearance for that. As far as the treatment goes, during pregnancy, treatment during every trimester is considered safe, but the second trimester is the safest to get dental treatment. Uh, let's keep going, Dr. Rishi. And yeah, like I said, second trimester is considered the safest. Usually we recommend that, like I said before, that patients who are planning on getting pregnant, they need to let us know. So usually if there is something major that needs to be done, either we do before the patient gets pregnant, or any non-emergency dental treatments are usually recommended to be done during second trimester of pregnancy or after delivery. Any elective procedures, like any cosmetic procedures or veneers that are just for aesthetics, we recommend that they should be postponed after delivery. Let's keep going there. So some of the things that we do in our dental office differently, and especially for our pregnant patients, to get our pregnant patients as comfortable during treatment as possible, are that of course we double shield them for x-rays, and we only take x-rays as needed, right? And when we are taking and when we have to take them, we double shield them. One of the lead vest is on mother's tummy, the other one is a regular lead vest that we use. Maintaining healthy circulation is important while they're getting their work done, so keeping their legs uncrossed. Some of our moms, they like to bring pillows while they're getting their work done. It can get otherwise, sometimes, especially if they need to get some work done during the third trimester, it can get uncomfortable being on dental chair for very long. Dental anxiety is very, very common, so we recommend for any patients, and then especially keeping our pregnant patients comfortable, that bring headphones, bring music, whatever gets you comfortable along. So so with all of these, I want to conclude with saying that for our pregnant patients, regular dental visits to dentists before and during pregnancy is very, very important, just so that we can take care of things when they are small or prevent things from happening. I always say an ounce of prevention is better than a pound of cure. So maintain your regular dental visits. take care of your oral hygiene, brush twice every day at least, floss, keep your tongue clean, use fluoridated toothpaste, fluoridated non-alcoholic mouthwash. These all things should be part of your regular oral hygiene routine, to keep that bacterial load down, just so that you don't have any health problems, and you don't the baby is okay. As far as diet goes, maintain a well balanced diet, drink a lot of water, keep hydrated, take your prenatal vitamins as recommended by your OBGYN, avoid taking all any medications and things that can be harmful to your health and the baby. For us medical professionals, holistic approach towards taking care of our pregnant patients is a must. All of us working together and refer to general dentist or other specialities related to dentistry in relation to the oral problems for pregnant and new moms for that matter, and children as needed, is very helpful. Early intervention in most all cases is very, very helpful. So with this, I conclude this presentation, and I wanted to thank you all again for listening to me. You all have been very wonderful audience, and open to question and answers if there are any questions for me. Thank you.
Thank you, Dr. Neha. It was actually a mesmerizing session. Audience, if anybody of you want to ask any questions, the guest speaker is in for that. I think, ma'am, you have explained the concepts very well. The people, they are actually not left with any doubts. So,
Awesome. I had a wonderful audience, like I said, brilliant people listening to me. But
yeah.
still, if anybody has any questions, don't hesitate. Feel free to reach out on my Instagram or Facebook or by email, however it's convenient for anybody. I'll be more than happy to help.
Yeah, Dr. Neha has shared her details over here. If anybody of you want to reach to her, you can reach her up on Instagram or the Instagram handles, Facebook handles, anything. So we shall call this off. Okay. On
Hello.
behalf of, yes, sir.
Please, you can continue. Please continue.
Okay, sir. Thank you. On behalf of IAPWC Punjab team and IAP Punjab chapter, thank you, Dr. Neha, for such an enlightening presentation on how, in the most important phase of a woman's life, she can take care and she can deal with one of the most important issues, the oral health. We appreciate this mysterious area clarified, and your advice, I believe, would have enlightened many people. So I would actually like to express my deep gratitude to the generous support to Dr. Sanjeev Kumar Jha sir and Dr. Ruchi Vashne ma'am and IAP technical team. Of course, without their help and support, this session would not have been possible. Thank you, everyone. Handing over the dais to Dr. Kaushik. Over to you, sir.
Thanks a lot. Thanks. It's a really a nice thing that today we were having that international speaker with us. Thanks a lot, ma'am, for be with us, and thanks to the IAP India, and thanks to Punjab branch, IAP Women's Cell, and the IAP to organize this wonderful webinar. And I just request everyone, please subscribe IAP India YouTube channel. Thanks a lot, everyone, to listening. Thank you.
Thank you, sir. Thank you, ma'am.